Root canal infection. Teeth are made up of several parts: the crown, the visible part, and the root, the invisible part between the gums. Despite appearing hard on the outside, the central part, or the pulp, is soft tissue composed mainly of nerve fibers that give the tooth sensitivity and vitality. It is important to maintain a healthy pulp. Without good dental hygiene, there is an accumulation of food, which when in contact with the pulp can cause infection in the root or root canal. And how do you get a root infection? Intraradicular or root infections can be acquired in 3 ways. Primary infection, caused by bacteria, generally from caries. Secondary infection, caused mainly by organisms introduced during a professional intervention due to contamination. Persistent infection occurs due to bacterial resistance. And what are the symptoms of a root canal infection? The symptoms of a root infection are mild to intense pain, sensation of heat in the affected area, sensitivity to touch or pressure, change of color in the tooth. How is a root canal infection treated? Root canal treatment, also called endodontics. Endodontics consists of the total or partial removal of the dental pulp, leaving the canal clean and free of bacteria. How is a root canal performed? First comes an evaluation to examine the tooth both clinically and radiographically, the number of roots, and whether or not there is an infection that could compromise the neighboring tissues. In the case of infection in neighboring tissues, the patient will be prescribed an antibiotic and analgesic before performing the root canal. Once the tooth is anesthetized, the dentist opens a cavity in the tooth with the help of rotary instruments. With the pulp exposed, the infected tissue is removed with the help of tiny needle-like instruments. The canal is washed, cleaned, and dried. In some cases, the remaining cavity is filled with medication or temporary materials to help cure the infection. After finishing the canal, the tooth is restored with plastic or resin material to restore both aesthetics and functionality. How can we avoid having a root infection? That's the easy part. Practice adequate oral hygiene at least 3 times a day and visit the dentist at least twice a year. Thank you very much for the explanation. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental as well as our Facebook page. We look forward to your visit and we will make a timely diagnosis. Our dentists in Oxnard, St. Paula, Ventura, Newbury Park, and Port Hueneme will be able to guide you towards the best treatment to take care of your health and give you back your best smile.